100 nations are gathered at the World Health Summit in Berlin to take stock of the COVID-19 pandemic. The World Health Organization stressed the health emergency is far from over, as every week around 50,000 deaths are recorded worldwide due to the pandemic.
Viruses move fast, but data can move even faster. With the right information, countries and communities can stay ahead of emerging risks and save lives. Urbanization, deforestation, climate change, and intensified agricultural practices are all increasing the risks of epidemics and pandemics.
Dr. Tedros said hopes of returning to normality rely on vaccines and their proper distribution between poor and rich countries. The WHO has set a target of inoculating 40% of each country's population against COVID-19 by the end of the year and 70% by mid-2022. The WHO also insisted on the need to focus on research and new technologies to avoid an emerging disease turning into another global health disaster. COVID-19 has caused the deaths of more than 4,900,000 people worldwide.
In some European countries, including Italy, most of the COVID-19 that occurred in care homes here in Italy, it seems that figures could be even higher, as many people had not been tested inside care homes. Now, prosecutors, not just here in Italy, but in other countries as well, launched criminal investigations into those deaths to see whether or not these could have been avoided. And as a result, hundreds of facilities have been inspected, and it seems that in many of these facilities, COVID-19 protocols had not been followed. And that's why Amnesty International is now calling for an independent parliamentary inquiry into those deaths, but most importantly, into reports of retaliation against nursing home staff who spoke out about unsafe conditions, with reports of employers silencing these workers through unfair dismissal. Now, Amnesty International based its findings on over 30 interviews with both health and care professionals, lawyers and union leaders, with union representatives who have been shown evidence of health and safety breaches, with workers being forced to work long hours. Now, the pandemic has taken a huge toll on staff in Italy's care homes, 85% of whom were women. It has been estimated that over 60% of workers who contracted the virus in the workplace were health and care professionals. Now, let's not forget that Italy was the first Western country to be hit by the pandemic, and as many other countries at the very beginning faced a lack of technical preparedness, and most importantly faced shortages of protective equipment such as face masks. Giorgio Orlandi, Euronews in Rome.